Hi, my name is Jonathan, Jonathan Zarin, and I have Still's disease. Now I just take Kineret. It sort of acts as a anti-inflammatory slash steroid. It's my miracle drug. We tried many different things, and each thing I would have to try for a week to see if it worked. And then if it didn't, and then during that week, if it didn't work, then there would be lots of problems. So then I would have to go to another thing and try that and this and that. And finally, Kineret, 3 days after I started using it, 95% of my symptoms were gone. Wow. And then since then, they really haven't come back. So this is my Kineret. It comes, actually, this is the safety cap. It comes like this, where it's just right about there. They look like that, and it comes with this little safety cap on it. So they all come in a little box. And then this is pre-filled, and there's the medicine in there. And then all I do is I just take off this cap, I lift up my shirt, and I just squeeze some of my little stomach fat right there, and I stick it in without, it's a little squeamish sometimes. Oh, there it goes.
How often do you do it?
Every single morning. And that's all I need to do. And you would think you get used to sticking a needle into yourself after taking it for now 6 or 7 months or 8 months even. You don't. Every single morning I cringe right before I stick it in, and then it hurts. And it's actually, you would think that it hurt when you stick the needle in. That's just like a little prick. It doesn't hurt that much. It's actually when I'm putting the when I'm squeezing this and actually putting the medicine into my body, that's what hurts the most. Well, you have to, there's a tiny little hole at the end of this needle, so it takes about 45 seconds to a minute. You can't just push it all in, so you have to hold it and very slowly until until it goes all the way in, just like that, very slowly. So it hurts that whole time, and then it hurts, that burning sensation hurts for another minute or two, but then it could hurt, I took it two hours ago or 3 hours ago, I could still feel it. It's still, and that never really goes away, because I would say you could feel those little spots, like they're little bumps. Not really little bumps, but, they're little...
Injection sites.
Yeah, injection sites, whatever you want to call them. And those injection sites do hurt, for a couple of days. And I'm doing it every day, and I switch off, if one side's a little sore, I'll go to the other side, so then both sides will be sore, and a couple days later they feel all right. But it's not like constant pain. It's just like if I touched it, I could feel like, oh, it's a little sore.
And storage and all that, what's...
Storage, I have storage for these. I have a sharps container that I just keep. I fill it up, and then, they're out of the way. I just put these. I always put these caps back on, and then just stick them in the sharps container. And then when it's filled up, you put the cap on, and it's pretty much supposed to not, open up again. And then you just dispose of it. Keeping it in the fridge is not a pain in the butt. Even though if someone's at my place and goes into my fridge, they're like, oh, what's that? And I guess it might be kind of weird to them to see. They are in boxes, but I guess you could tell they're kind of needles and medicine. And then people are asking me questions. Oh, what's that? What do you have? And then I have this whole conversation that we just had again with them. But what is a pain in the butt? Traveling with them, because they do need to stay somewhat refrigerated or in a cooler. And I travel a lot, so on an airplane, I just find myself bringing the whole cooler that they send me. So I carry this big box, and then it's like a carry-on, and I can't bring a carry-on, and I'm carrying this big box all over the place, and it's kind of annoying. I get them through this this mail pharmacy. It's pharmacy through mail. I don't pick them up, so they ship them in this cooler, in a styrofoam cooler, and they come with ice packs. And so, you know, I hold on to those ice packs and that cooler, and I just use that again. But it's this big sort of cumbersome box. You know, it's kind of annoying to travel and have, you know, a carry-on and a box that's, you know, this big, and you're trying to hold on to that. And so, and then once you get there, you need to make sure you get to a refrigerator right away. I mean, really, I'm just talking about all of these are the worst things, you know? I try to stay positive. These are the worst things that I have to deal with this. Really, it's not that bad. It could be a lot worse. You know, okay, so I have to carry a box around and I have to do this every day, but I feel great, you know? I feel good. If this is what I have to do to feel how I feel right now, as opposed to how I felt, you know, almost a year ago, I'll do it, you know? And it really doesn't bother me. I feel really, really good now, and I'm very happy for that. Normal healthy is, I guess I feel normal healthy when I take this. You know, just being able to live your life and not having a medical condition obstruct you from doing anything you want to do. I'm normal just like anyone else now, you know. I just have to take this medicine every day, and I feel great.